David was just talking in the studio there about what we're seeing in terms of the changes in the Chinese healthcare market. How would you characterize the opportunities but also the challenges in this market?
Yeah, so as you know, the first time actually President Xi Jinping stepped in a healthcare forum in 2016 and really have asked for Healthier China 2030. So literally policies are opening, which will of course drive a lot of opportunities. So opportunities is definitely on chronic diseases. I think the priority is made on the prevention, how to better treat chronic diseases. Opportunities also is acceleration to innovation. We saw some recent policies to accelerate and to speed innovation.
What growth are you looking at for 2018? Because you've posted some pretty impressive numbers here in China. The last quarter, third quarter, 12% increase in sales. What are you looking at for next year?
Yeah, so we can't really disclose, but when you're looking at the past of Sanofi China, we're doing pretty well. You could see actually this year, Q1 growth over 17%, Q2 growth over 17%, Q3 growth over 12%. And literally, how is it due? It's two factors. We are one of the leading companies in cardiovascular and diabetes, so we could address your huge need. But also we are doing the expansion, geographic expansion. And you could see the policies are really in favor of developing the rural area, but also the primary care in the big cities. So we are the ideal companies to address these potential needs.
So double digits next year?
We'll see. Let's keep humble, but we are very confident. Okay,
tell me about your JV partner here. Are you looking to expand that partnership as part of the strategy?
So the JV, you are referring to the CHC, the CHC with China Resources. So, yes, as you see, the CHC is a global business unit for Sanofi. It's very, very important. That's why we integrated this year the business from Boehringer Ingelheim. So the key question was, what do we do in China? And here, of course, we want to be a key player. And I think part of strategy, when we say innovation, commitment, partnership, I think to be a leading player in CHC in China, it makes a lot of sense to build a partnership with the leading Chinese company, which is China Resources. So we start with the portfolio, but then we have a lot of ambition to plug our global CHC portfolio into China with, of course, the help of China Resources. So this is your ambition.
Might you in the future look to additional partnerships?
We are. I think, like I said, on partnership, this is one of the core strategy. As you know, we are developing with GHL in Wuhan, which is in Hubei, a biologic, a biosimilar. So we'll go into biosimilar to address affordability. But we're definitely looking at other partnership with, for example, NHFPC in stroke and the stroke prevention. You know that you have 10 million cases of stroke, 2 million cases every year. So this is literally something that we have to address, and we are building a lot of partnerships. So yes, local state-owned companies, also a governmental institution like NHFPCs, and actually this morning, Fortune 500, we are talking with Guangzhou about how can we build partnership in AI on a big data.
What might that look like? That partnership in terms of AI?
Well, we can't disclose at the moment, but definitely AI on big data should be an integrated key part, still strategic part of the healthcare industries, definitely.
Okay. And in terms of the reforms that we're seeing here in China, those moves to make it easier for foreign pharmaceuticals to bring their drugs into the Chinese market, is that starting to impact you now?
Yes, of course. We have a couple of examples. For example, the indication of Lentus. You know, Lentus is a top leading insulin, glargine insulin in China, but also in the world. So we have actually an accelerated approval for Lentus pediatric indications. We are also a leading company in rare disease. So we have clinical trial waiver, such as we don't have to conduct a lengthy process of clinical trial. So we do see definitely acceleration in unmet medical need only, of course. So pediatric indications, rare disease, oncology, severe diseases.
How reliant is the broader Sanofi company on what's happening here in China? Because you're seeing that strong growth, but beyond the Chinese market, particularly in the US, there is this pressure on pricing now for the company. Are you under increased pressure just because they're so reliant now on the sales they're getting out of China?
Yeah, so I'm not the US specialist because my specialty is in China. So I think you need to ask our CEO or the head of US to comment about that.
Okay. Would you expect that potentially the broader company might be looking at acquisitions, though, more broadly? Is that part of the makeup in terms of growing the business? Is it less reliance on organic growth, more on deal making?
Yeah, I think there's been talk about that, but again, I'm not the best person to disclose this information. Like I said, my focus in China, I think I have a lot to do, but I think, yes, there's been discussion around that, but I cannot say much because I'm not part of the discussion.
Okay. We interviewed the CEO of Guangzhou Pharmaceutical a few weeks ago, and they're doing a tie-up with Medea in terms of automating some of the pharmacies. When you talk about AI and the discussions that you're having there, is that something that possibly you could look at? How much is that going to change the landscape here, the automation of the healthcare sector?
Yeah, no, but definitely. I think internally for us, definitely we are on the research, such as screening quicker to get the right molecule is going to be a big advantage in terms of development. Recruiting quicker the patients is definitely an advantage. Manufacturing, especially when you are manufacturing biologics, we have actually for each production line like 5,000 parameters, such as we could analyze quickly and to provide a better actually productivity and quality, but actually all across the value chain. Externally, for the patients, definitely helping a better prevention, such as you could avoid serious diseases as stroke or MI, the myocardial infections, but also the diagnosis. And I think the diagnosis is a key things, particularly in medical imaging.
And a big focus at the forum over the last few days has been on the digital economy, and we've heard from the likes of Tencent's Pony Ma and Jack Ma from Alibaba. Would you ever consider partnerships with the big tech companies here to try to expand your growth?
Yes, so we already signed, and actually I will hope Chairman Ma will disclose the information, but we signed a partnership with Ali Health, which is a part of Alibaba. We signed it actually 2 years ago. We are actually in talk with Tencent. And actually also in talk with other company, which I cannot disclose, but you understand that the providing the better healthcare cannot belong anymore to a pharmaceutical company. You need to play with different key stakeholders, such as we will provide a global solution, and part of this global solution, AI on big data, are very, very, very important.
Let me push you on the Tencent conversation then. What kind of partnership might that look like?
I will show you the WeChat. So I know in the US you are using the WhatsApp. Here in China we are using the WeChat, and this is really, really powerful. This is the WeChat. You do whatever you want with WeChat. And we do see actually in China physicians who are already doing consultation with patients on WeChat. So it's important for us to be part of the game. So that's why Tencent is the leading company for the WeChat, and that's why I think we think that this tool is very powerful. Definitely we step into healthcare, and we need to be part of the game.
And what do you want to see from the authorities? Further reforms? What further steps could they take to improve market access for farmers here?
Yeah, so literally what we say, because I'm also the chairman of RDPAC representing 41 MNCs here in China. I think, to be honest, the challenge in China, which is unseen, is how to give a better access to 1.4 billion Chinese citizens. Okay, so I'm French, 65 million. Here we're talking about 1.4 billion. So there's been a lot of progress, like universal coverage. 95% of Chinese are covered, but we could do more. So the could do more is literally how to accelerate access to innovation. So we saw good improvement from CFDA. Now we want to see improvement around the pricing and reimbursement. And actually we are working jointly with the government how to provide the best solution.